Alright, team. I've observed the patient presenting with granuloma, hypophysitis, and episcleritis.
What do you think is the diagnosis?
These symptoms could indicate a few different conditions. It might be tricky to pin down.
I agree, those symptoms are quite broad. We'll need to run some tests to narrow it down.
I'm leaning towards a possible autoimmune disorder, given the combination of these symptoms.
You're all dancing around it. It's Rudiger syndrome, no doubt about it. And the treatment we'll proceed with is 4-quarter amputation.
But that's an extreme measure, Hawks. Are you sure that's the right course of action?
4-quarter amputation. That's incredibly risky, even for a seasoned surgeon. Are you certain, Hawks?
I've never even heard of Rudiger syndrome.
Are we really prepared to take such a drastic step without exhausting all other options?
Damn it. We don't have time to waste. I know this is the right call.
Get ready! We need to save this patient's life.
You called me in, Tracy.
What's the problem?
Hawks, I heard you want to perform a 4-quarter amputation on your patient.
Are you sure this is necessary?
I've been practicing for years, Tracy. I know what I'm doing. This patient has Rudiger syndrome, and it's the best course of action.
I understand your experience, Hawks. But we need to consider all options and consult with other specialists before making such a drastic decision.
You're doubting me? After all of these years of dedication and successful surgeries, you dare question my judgment?
I'm not doubting you, Hawks. I just want to make sure we explore every possible solution before going forward with something so extreme.
Well, I won't stand for this. I know what's best for my patients, and I won't let anyone stand in the way of that.
Hawks, I respect your dedication to your patients, but we have protocols to follow. Let's discuss this further and come to a collaborative decision.
Fine, Tracy.
But remember, when this surgery is a success, you'll see that years of experience speak for themselves.
Oh no, this is not good. The patient is in critical condition after the 4-quarter amputation. How am I going to tell Hawks that we made the wrong call on treating Rudiger syndrome?
What were you all thinking? You nearly killed our patient with your incompetence, choosing the wrong 4-quarter amputation area and misdiagnosing the condition.
But Dr. Hawks, we did the best we could with the information we had at the time. It was a difficult case.
I still believe my diagnosis was the most likely scenario, given the symptoms presented.
No, Kelly, you were way off. It was clearly a nerve issue that required a different approach.
You're all a bunch of bumbling fools. How did you even get through medical school with such incompetence? I'm surrounded by idiots.
We followed protocol, Dr. Hawks. Sometimes medicine is not an exact science.
Protocol. My foot. You are all a disgrace to this profession. I'm done here. Figure it out yourselves. I can't believe I haven't figured out what's wrong with the patient yet.
Maybe you should try checking for a rare infection or genetic disorder.
I've already looked into those. It's not adding up.
What about a potential allergic reaction to a medication?
No, I've ruled that out too. Wait a minute. I've got it.
What is it?
I know exactly what's wrong. I'll see you later.
Hey, wait. Where are you going? Hawks, come back.
I don't have time to waste on medical equipment. I need everybody's attention right now.
What is the meaning of this, Hawks? You can't just barge in here like this.
This is highly unprofessional, Hawks. You can't be jeopardizing the patient's safety.
Hawks, you are out of line. Explain yourself before things get out of hand.
Listen up, Rudiger syndrome was a misdiagnosis. I'm diagnosing Glanzmann's thrombasthenia, and we need to act fast. Tracy, I have to say, I told you so. If you had just listened to me from the start, we wouldn't have had to go through that whole mess with the wrong diagnosis.
Oh, come on, Hawks. The wrong diagnosis nearly killed the patient. You can't just blame me for this.
Blame you. You were the one who insisted on your diagnosis without even considering my opinion. You could have killed the patient yourself.
Excuse me. I could have killed the patient. You're the one who has a history of making reckless decisions without thinking things through.
Reckless decisions. At least I take risks to get to the right answer. Unlike you, who plays it safe and nearly missed a life-threatening condition.
Playing it safe is what saves lives, Hawks. Maybe if you learned that, we wouldn't be in this mess right now.
Oh, please. I'd rather take risks and save lives than play it safe and put them in danger. You need to start listening to me more often, Tracy.